Dr. Preece, let's talk a little bit about periodontal disease. And here's my feeling. On an average, I hear dentists talking about periodontal disease leading to tooth loss. Basically, you lose your teeth actually, and you lose the bones where the teeth are sitting in, and all of it is just not a good thing. However, here's my feeling, and you tell me how off I am here. In the end, the teeth can be replaced. You dentists do a wonderful job putting crowns, bridges, even dentures, which are rather inexpensive, and of course the modern way of implants, which make it. There is probably people out there like Julia Robertson, and I'm not saying she has all implants by no means. I'm just saying many movie stars probably do have all faked teeth simply to make him looking the way they want to make him looking. Do you know what I mean? So, so it's a wonderful thing, and it's really not a big problem, rather than having to go through the hassle and spending the money. But, it can be fixed. Now, however, what cannot be fixed, in my opinion, or very difficult to be fixed, and would be dangerous, is while this is happening, while you're losing your teeth, which may take 3 to 10 years, whatever, you're having an infection in your mouth. And an infection is an infection is an infection. It poisons your body. And this infection is in the mouth, which is the gateway to the blood vessels. No part in the body goes so fast, the blood vessels into the blood, than in the mouth. Take a little bit of salt under the tongue, and you got it right in your blood. So you poison the kidney, you poison the liver, you poison the blood in itself. Heart disease, brain, name it, and who wants to have bad kidneys or bad liver and whatever it is. So that cannot be fixed anymore, and that's going on for years and years. So it looks to me that poisoning, the gum disease, the poisoning the gum disease is doing is a lot worse than actually the tooth loss, which every dentist is doing as the bad thing, and yet forgetting that never mind the tooth loss, that at least can be replaced with a little bit of money. Lots of money maybe, but at least it can be done. But how are you going to get your kidney back? Shed some light on it.
Yeah, that's a tough question. The bacteria that cause the infection there cause inflammatory reactions that travel through the blood and can cause trouble in the heart and the liver and the kidneys and that, just like you said. So how reversible that is, I'm not sure. If it's irreversible. I know with the heart disease, that seems to be irreversible. I'm sure it would be in the kidney and the liver, and that also, that cumulative damage that occurs over a number of years.
So it's bad. It's bad to have that. Yes. You don't want to have it. Yeah. So you want to take care of a gum disease before, as it develops, and you want to take that infection out. Wouldn't most people, when they have a yellow, ugly bus in their toe, in their finger, anywhere, wouldn't they go to, most of us go to a doctor for little shit like that, right?
Yeah, most infections anywhere in the body get taken care of a lot more quickly than they do in the mouth. For some reason, we tend to ignore them. The trouble with gum disease is most of the time it doesn't hurt until the very last end stages, and so most of us are motivated by pain. And if we don't have pain, we forget about it. We just keep on going. The other thing that we need to mention is, even though we can replace the teeth with implants or dentures or whatever, there's nothing we can replace the teeth with that works as good as the original equipment that God gave us. A natural tooth, a natural teeth can chew a lot better and be maintained better than any artificial thing the dentist can put in, no matter how good of a job he does. So just from that standpoint, it'd be nice to keep the teeth rather than have to go through all the work of having them replaced too.
Well, of course. I'm sure that is true. It just, to me, it is so. I have read, for instance, in California, there was a lady who had a stillborn baby because they found infection from the gums in her placenta. Did you read that? Are you aware of that?
No, I hadn't read that story. I've read numerous articles, though. There's kind of controversial in the literature as to whether gum disease and infection can cause increase in premature births, for instance. It seems like the evidence is about half and half on that one. But as far as some of the other things, such as having it affect the heart, that's pretty well documented that does happen.
Well, I mean, it makes sense. I mean, if you have an infection, obviously your body's soldiers, they need to go to that area to kind of like distill the infection. And it's like with war. I mean, in America currently we fight 2 or 3 of them, you know what I mean? So if we would have another one over there somewhere in Korea, I mean, that wouldn't be good. I mean, there's only so many soldiers we have, right? Mm-hmm. And I mean, exactly. I think it's the same with the body. Like in Japan, there was a study that the HIV virus, which is not AIDS, can easily turn, or has been proven based on their study, that it can turn into AIDS, full-blown AIDS, because of gum disease, simply because gum disease makes your overall immune system bad. Now, thanks God, not everybody has HIV virus, so it's not necessarily that much to worry about it, but I mean, if it can do something so devastating, turning HIV into AIDS, what about the next flu season which is coming? Wouldn't the body be weakened, and would you want to have that?
Right. No. That's a good point, and that's true. Anytime you have a chronic infection, it's going to weaken the body in such a way that it's not as strong to fight all the other influences that come upon it. So that's a good point.
Good. So basically, you are concurring with the experts out there that gum disease, yes, number one, it loses you your teeth, and obviously that costs you truckloads of money and lots of ugliness until that happens, lots of stinky mouth in between and all that stuff which you just don't want. And nevertheless, during those years, you have an infection eating away at your body and poisoning your body daily and throwing all kinds of immune systems out of wacko, which might or might not ever be able to be corrected.
That's true. That's exactly true. So I would say that it's. Pardon?
Let's fix it. Let's get that let's get that dirt, that rotten chicken scraped out of the mouth so that they infect, because that's really all it is. You kind of basically scrape the infection out and then one is okay again.
Right. Gum disease can be we haven't found a way to cure it, but we've found a way to keep it in remission and treat it. So if the technology we have today, you can keep it in control and keep it at bay anyway.
Wonderful. Thanks a lot, Dr. Preece.
Thank you.